Seattle Children's is a world-renowned pediatric treatment institution. It's also the Seattle Children's Research Institute and Seattle Children's Foundation. I'll tell you, in many ways, you can't do healthcare without good information technology and information services supporting the mission. It's a great mission, and it's not hard to understand. When you walk out of your office and walk down the hallway, and I almost get chills when I say it, when you walk out of your office, you see exactly why you're here.
As we reached out to the caregivers at Children's, asking them what their pain points were when interacting with the IT infrastructure, we found two common complaints: long wait times, long log-on times. Secondly, there was a significant lack of consistency. Everything was different everywhere they went.
The bottom line for this is we want to make the information technology that they use as unobtrusive as possible. I want it to be there when they need it.
Using Citrix XenApp and XenDesktop has allowed our caregivers to get access to the patient information much faster, much more consistently.
The new technology has had, in my opinion, a really huge impact on patient care. Before we had Citrix Virtual Desktop, I would have to log on to each computer and wait for it to boot up. Then I had to close down all my applications at my desk, and I'd go down to clinic, I'd have to open them all up again.
When you have 20 minutes to see a patient, you don't want to use 10 of it waiting for the PC to boot up.
We really addressed this by starting off doing the server virtualization work in the data center, and then we virtualized applications, and that led us to desktop virtualization.
We hit the tipping point when we started using the XenDesktop. That has been a revolutionary change.
That was the point at which we were doing some things that maybe nobody else in the country was doing, and I wish I had a nickel for everything that we virtualized that the vendor said, I don't think you can virtualize that, and we've been able to do it.
Virtual Desktop really allows me to maximize the time that I spend in face-to-face contact with the patients that I see.
We're virtualized end-to-end from the data center to the desktop, and we're providing our virtual desktops to any device that the Citrix receiver or Citrix client runs on: Android, iPad, Apple, and Windows. If you've got a device, we'll put our image on it.
The reason I need to stay connected and to get information about my patients is that they need care all the time. So what's awesome about virtual computing is that I can log on and I can have my desktop that I have at the hospital with me anywhere in the world.
At Seattle Children's, we're as concerned about money as anybody else is. So this first year, we're looking at saving about $1 million. Subsequent years, about $450,000, $500,000 yearly. And then if you were to hit that fifth year once again, that'd be another $1 million. So it wasn't a super hard sell to the CFO.
It has been a massive transformation for the department in the last 3 years. We've changed everything.
The system that we've provided and the time savings and the improvements that we've made have allowed us to provide direct help to the kids that we serve.